did not give me something like that. She just gave me frequency stools being infrequent, color being same, sometimes hard, sometimes yes, mucousy, like sometimes explosive diarrhea, which is more suggestive of functional constipation. She gave me the history of that. And then I was thinking, yes, it's actually history of that. Mucus or any blood, any hard to flush. No, she did not give me that. Hard to flush is again suggest for celiac disease. You need to have all that history. Again, have you traveled? I did ask that. Like, have you traveled recently? Apart from this investigation being done, have you traveled? Like giardiasis was in my head as well. Yeah, no. Okay. How's your eating pattern? I did even ask. How's your diet? She no ate normal diet. I'm like, okay. You don't need to worry about the diet. Now you take it green. Yeah, I take the green. I take the everything. Whatever the doctor. Because she was very agitated. She was like, whatever doctor says, I have done that. I'm like, okay, fine.
Fine.
You drink a lot of water. Who is this? Someone is unmuted, or someone is actually on the. Okay. Guys, check your phone. I won't go further if you're not checking your phone. Okay. Hmm. It's alright. It's okay, Augustine. You don't have to worry about it. Just because it start echoing my voice and it will disturb everyone, nothing else. It's okay. All good. So anything relieves it and makes it worse. She said that, yeah, she told me this one spontaneously. That, when I release the stool, the pain relieves it and it happens on the left ventricle. She gave me a spontaneous history on that. And do you have a nausea, vomiting, any weight loss, any lethargy? Please do not ask lumps and bumps, because when I asked her lumps and bumps, she was like, what do you mean by lumps and bumps, doctor? What is lumps and bumps? I was like, okay. The way she was aggressive on me, and I was like, okay, don't worry about it. We will think about that later on. Do you have any significant weight loss? Because I got annoyed. I was like, the way she was acting, I couldn't be bothered actually asking. And again, in order to rule out a proper malignancy, you need to ask this: significant weight loss, any tiredness, any fatigue. Okay? Please do not ask lumps and bumps anymore. I don't know why they are worried about this. Then they're not giving a proper history for that. Any medication she's taking, for example, laxative to like softening, stool softener. Don't use laxative as a word. Stool softener. Okay? Any antibiotic she has taken for oral sore throat or anything. She said no. And I told her, I can see that you have done all sorts of tests and it's needle number time. They all being normal. So I need to ask further question in order to find out what else can be happening. Have you had any accident, any surgery, any chronic family history of similar condition? You need to ask because that can runs in the IBS can run in the family, so is the OCD. Now, social factor. I've been into that, which is a heads. Are you going through this? I asked her, how's your mood being? She's like, yeah, fine. I do have some time lower back pain. I'm like, okay. How's your sleep? Problem? No problem. Are you anxious person? And I don't know from nowhere why my head said that please go and ask. Is she's perfectionist by nature? And I was like, are you perfectionist by nature? Because my history taking was very good. Are you perfectionist by nature? Because my history taking was very good. Are you perfectionist by nature? She said, yes. I like my things in order, in a sequence. I was like, oh my god, she's giving me obsessions here. Signs of obsession. She, yeah, I like my things okay. And I'm like, okay, how's your relationship between, how's your work, how's your relationship with your partner? Everything is fine. There was no problem at all. So technically, she had this perfectionist nature as in history, which she gave me was a trigger factor for her. Okay. I did ask that anyone in the family history or any concerns, any family history about, why you screening so many times, funny so many things, because the diarrhea is not going away. That's why people actually giving her a different investigation she want to rule out. Okay. Now, since we have already thyroid, everything being done, colonoscoping being done, you would not be talking, you will be ruled out cancer, and the history is must. But having said that, you will be mentioning because you won't have so much taking more detailed history. Psychosocial history itself is long. You need to do aseptic, you need to do heads, mandatory. You need to say that this is IBS, irritable bowel syndrome. Okay? It's affect the bowel on the left side. He didn't give me any history of surgery, no any bleeding. She didn't have a bleeding, no mucus, nothing. That's only heart stool. And again, ribbon like stool, which is very classical sign of that. It releases when you pass the stool on life leafy fossa. That's a very classical sign of that. Okay. She did not give me any stress, but yes, you have a perfectionist nature. by nature. People who are perfectionists and they stress a lot on certain things to be happen in order, but they can suffer through the same thing which you're going through. Now, I'm concerned about still be certain things. I need to run for the investigation. We have done all the investigation. Sound nothing to be aggressive, sinister, no thyroid problem, no stool. But I'll be repeating my stool culture. What you can repeat? You can repeat only stool culture. You will actually be calling her for colonoscopy in future. At the time, this is normal. No family history of cancer. Also, you will be getting telling her. I told her eating the green vegetable diets, doing a lot of water. I know you're taking healthy diet. That's fine, but it is again to relieve the system. Again, you need to do a relaxing exercise, conservative management. I went into after conservative management. So relaxation exercise, do the yoga, take the time off. I know you want things right, but sometimes it taking time off to recover better. So I think it would be best you will be take time off to recover better. Okay. And then you need to be talking about mind body axis. If you want, this is the only condition. This one, somatoform, it's the only condition where you have to be talking about mind body axis. You said that there is another condition called somatoform. It's quite similar. I was thinking maybe addition and tummy what happened. We can explore that, but I don't think so. There is any like a genuine medical condition going on. Thyroid being normal, no drugs, no nothing is there, which I would say that you need a treatment for pathological because we gave a treatment for pathological reason, but there is nothing pathological going on. Let's try with the cognitive behavioral therapy, which is a relaxation therapy. I told you what is actually AMC loving it. They're loving the cough talk therapy and relaxation therapy, and that will relieve them. Okay. Otherwise, routinely you need to talking about the RSCGP guideline. What are the follow-up for colonoscopy? We didn't find it. We will calling you next 2 years time, and we need to, if at all there is a family history, we could have done all family history screening for cancer. Okay, everyone clear with that one? So none of you actually said somatoform. None of you thought about the addition. You need to come with a general differential in that case. If you're not actually coming up top of those differentials, they had given the differential in their question basically. If you're not giving a spot on diagnosis and other relevant differential, there it's a chances there you'll fail. And that case is a failing case, to be honest. I don't know why. It's a famous failing case. Any questions? Last two. We still have a lot to go. Yeah, any questions? No? Are you guys clear? So metaform would be the another differential. That's it. Hypochondrosis. Okay. Psychiatry 2. You can think malignancy 1. You can have addition as a post-surgical 3, 4, at least 4. Even though it was not that is the most probable. Apart from the what is given there was actually a differential, but you top of it you will be giving this one because that is not ruled out. I think that was the one reason people were failing because they couldn't find out additional. It's not a diagnosis. You say that there is again a mental health condition where you find already ideation there is a cancer and then you try to rule out that. But that's a somatoform. They have an already a preoccupied idea that there is an ideation that they have a cancer and they explore it, especially hypochondrosis, and that comes as a bodily symptom. Same thing. Even if you go hypochondrosis question and somatoform, go and open if you have it. Somebody must have actually covered psychiatry for you. They do multiple screen and then they come with that. So this is case was a little bit overlap. I felt like this is actually even heading towards somatoform. They want to know that somatization is coming as a symptom. So they wanted to see that whether you keep that as a differential or not. And nobody is actually trying to do it. And again, they were saying it could be family problem. In Karen notice a family problem, family problem. No, in the real time history, there was no family problem. It was a perfectionist by nature. Okay, so she was an anxious person. All right, this question. This is just a constant question, already diagnosed, and I've been told this came in. Although a lot of the questions come as a recall, people still do it wrong. I have no idea why. Okay. Um, maybe out of nervousness you say things which you're not supposed to. So this case came, 7-month-old boy noticed noticed by brother, noticed two lumps on B, and the left side is the testes and on descending testes, and then again there are two lumps as well. So you have tummy hernia and inguinal hernia, provided you have a undescending testes. Now you need to have I think I was discussing with Rajiv before he goes for exam, and I was discussing how will you approach this one. Okay, because what he was saying, he kept on saying things in the counseling session, because they already diagnosed the thing for you. You don't have to kept on saying. Best is approach in all counseling session. You need to say things, yes, but you need to ask a reasoning behind it. For example, I'm thinking of hernia. Hernia is more common in a hypothyroidism. So I was like, I will be explaining hernia, then I'll go and stop and I'll ask the mother either the child was preterm or were having a hypothyroidism, or Hilpert test has been done, has been diagnosed with that. If she will give any history of that, then I will be actually saying, okay, we need to do it in order to find out if we need to treat the hypothyroidism. It's not just about the hernia, okay? So you need to be actually asking at least one question so that you have a two-way communication going on. You don't just go ask, assist, and there's a 5-way: ask, assist, advise, and adopt. So in that, ask, assist, and advise. Even there is a two-way communication going on. So if you don't have it, it's a little bit of a problem there. Okay, you need to have a two-way communication going on with this. This is not the one talk and walk on. Okay. So what are the differentials when we have a mass in the tummy? My friend who's Pariyal, she passed her exam because we used to study together. Okay. She used to study for exam. So what she used to do, she used to say, can I see the lumps and bumps anywhere? I was like, okay, why are you looking for cancer? She's like, no, I asked you hernia. I was like, is that a hernia question? So please be specific in such broad of hernia you're looking. You just can't be saying randomly lumps and bumps and I'm looking for lumps and bumps. The examiner would be like, what lumps and bumps you on about? You could have in a neck, you could have a lumps and bumps in groin, you can have a lumps and bumps in tummy, everywhere. Okay, be specific in pediatric cases. Okay. Now, so what are the differential? Umbilical hernia, inguinal, pyloric stenosis in children. This one is 7 months, but still we thinking about intussusception, malrotation of the GERD, and the Wilms tumor in the central tummy. Okay, so we would be actually having this as our differential. So first of all, either you can start. I have a different presentation in this case. Is actually you need to ask from the mother because there's no background of it. Either you ask background or you go and explain, I found this, I found that, I found this, and then have a two-way communication. I usually start with that. Hi, my name is Rachna, and again in pediatrics, please have a lot of reassurance and empathy, full of empathy and worry on your faces, because all of the parents which are sitting there, they are anxious and they almost want to kill you. So you would be like, calm down, calm down. You make more words, sweet words like, oh, we are here, I'll look after, because that will give you more score. And reassurance through words is important, not by giving a gesture, like not keeping your hand on the patient and saying, okay, I'm here with you, I can help you, then you will lose the marks. But more about empathy. Reassurance, constant reassurance is very important, because they might not be convinced that is actually, that's going a right treatment. Another thing is that in Australia, majority of the white people in real life, actually, they are they almost there to kill you when you're going to do a wrong treatment, and they are very sensitive. Trust me, my Australian boyfriend, the Indian guy, but still he's Australian. I know the way he's delegated. Okay, and I feel like reassurance, reassurance, and they act so delegated, you will be surprised. So what they're doing in a real life in this AIMS exams, they're bringing such scenario where patient will be agitated, crying, almost feeling, yelling, and you need to calm down. And I think I never had a struggle with calm down, because I had you create empathy voice. Please create empathy voice in this case. Okay, because there are a lot of news you're going to talk about operation, and operation, they jump, they're like, operation, oh my god, I'm not going to do it. and steroid. Oh, doctor, I heard that it becomes bones become porous. So they come up with that stuff as well. So when did you first notice? When it was exactly? How big is the swelling was? And have you noticed any swelling by yourself? Is that the reducible, non-reducible spur? Have you noticed? Very important. Hernia has incarceration. If they strangulate it, if we do not assess this well, and any hernia, umbilical, inguinal, any hernia anywhere can cause blockage, which is strangulation, and can cause acute obstruction and and again irritable child. So you need to ask this: the child has any difficulty, any redness on the swelling? One, or have you noticed any passing pee and poo has been affected? Is the child being irritable? In all of those differentials, the child will be very irritable, except the Wilms tumor. Okay, so you will be irritable or actually drawing a leg towards the tummy. How is the growth as such, and how is the birth was? Because birth history premature is very important, and any heel prick has been done. Has it been immunized up to date? Would be up to date in this one, and are you being concerned about any double? Now, you after asking this, you will be saying, okay, I have found two lumps. One is in a tummy and one is in inguinal region. Along with that, on the examination, it will be giving you a statement that I didn't find one of the tests is being descended. So let me just explain one by one what is going on. What we have on the navel, which we call umbilical hernia. Okay, that usually present as a child development and growing age. So it will be disappeared. But what does it happen? Why the hernia happen? Hernia is a weak point happen. The outside of pouch happen because the tummy wall is not properly. Okay, and that could be happen if the baby is preterm, which I asked you, like born earlier, or having a hypothyroidism. So we need to actually do some tests to find out if he has a thyroid problem. Okay, now can it be dangerous? Yes, it can be if it all is being infected or strangulated, which is obstructed. If it's red and strangulated, it can be infected. Please do advise in umbilical hernia that it could actually don't they should not put the tape, and they should not put the coin or press it. If they will put the coin and press it on the umbilical hernia, it can become incarcerated. You need to be remembering this some certain dates for your this question. You need to say that they are usually small, reduced by 12 months of time, and if they're large, they reduce it gradually by 4 years, and they disappear by 4 years. If it doesn't disappear by 4 year, then of course we will be looking for surgical method to actually disappear. We are actually expecting congenital. This happened because of congenital anomaly, and it can require because prematurity, and it can cause frequent constipation as well. So we need to be watchful of that. Now, coming back to the inguinal one. Inguinal one again, there is abdominal content come to the inguinal canal is there, and it moves out, and again it comes as an outside pouch. Okay, now this can cause a serious damage, which is actually strangulation of hernia, and then anytime child could develop again this one, any vomiting or constipation. So you need to be actually cause a strangulation as well. That's a very reduce the blood supply and can compromise and can cause death as well. So we need to repair this one. Usually, if it also says 7 months, if you go back to question, the repair is required within a 2 weeks time. So remember, this thing inguinal hernia and all. So requirement of this is more important, that you need to remember 6 into 2 weeks. If you find out the baby is 6 weeks old, within 2 days time you will repair it. If it, find out the inguinal hernia, it's like the child comes within 6 weeks to 6 months, 2 weeks time. If a child is above like 6 months, then you need to do within 2 months time. You need to do a surgery. Okay, and if we not repair it, cause strangulation, and gangrene is keen or black, and again it will be irreducible. Then it's more dangerous as well. That's why we have a one case for incarceration hernia. Now, if at all this case is coming with undescended testes, we tell that mother we need to do octodopexy. We have here we need to do octodopexy, which is it happens in a premature male most of the time. And if testes are not palpable, we need to review it first of all, the child in 3. If it's 3 months old, if at all it's not going back, we need to surgically remove it. repair it. So most likely you need to surgically repair. We do orchidopexy as a surgery, and if you don't repair it, it can cause a fertility issue. So he might not be fertile in a later on life. Again, it can cause trauma, and again, very much likely chances in adulthood it can become a cancer, which we call seminoma. Okay, optimal repair is actually within to 6 to 12 months of age, which means right now. Prognosis is good, and don't worry that testes will be coming. They will draw the testes by from the inguinal root, and they will bring it downward towards the scrotum, and he should be fine. Okay, don't worry, you are in safe hand. We have a best pediatrician available. All of these surgical methods will be done under general anesthesia. Adequate analgesic, adequate pain relief. Don't say which anesthesia. I think it's very judgmental to in terms of maybe we are not the expert what anesthesia to give. Rather, I think I say that I give in adequate pain relief. That pain a child will not come to know. He will be given adequate pain relief throughout the time. And again, he would be followed up for the post surgical repair. He will be followed up. Everything's are functioning fine. He will be checked by the specialist. Also, we will be reviewing him time to time just to make sure he does not develop anything else. Apart from that, you will be doing thyroid function testing prick and to make sure that there are the other congenital anomalies being addressed. Okay. All right. Any question with that one? Any other person? No. Anyone? We go to next. If other people will say next, then I'll go to next. Otherwise, I'll stop it here. Surgery within 2 days, not referral. Dear, if at all, if it's, our child is within 6 months to 6 years, so you will refer him. Okay, I will leave into refer him within 2 months time. He should get repaired. The date, the things is I have given that. Okay, people forget this one, this number. Okay, write it down somewhere and you remember this number. I've given it in the slides actually so that you remember it. Okay, and what if we don't do it urgently? You will refer it, but they will consider doing based on the severity. They will consider within 2 months. This is a time duration we said. Okay, within 2 months. So they can, if they prognose like if the patient is serious, they will mind to it within 2 days as well. Okay, next one. Uh, I keep talking. And then brought her 3 years old son GP cleaning. Oh yeah, this one snoring and mouth breathing. He's known to you, so you're known patient, right? And you treated him for recurrent otitis media for last 12 months. Who had a flu-like symptoms in 3 days ago. I have a very interesting pictures today in this one. Because I think I had a struggle myself when I was doing this case, and I think Angelica, one of my study partner, I mean, she actually studied with me for 1 week and then she dumped me because I was too smart. I don't know why people would do that. If you're too smart, then you get dumped as well. So, so yeah, she was struggling with this question and she had actually, I remember this question because she had it every time she gave exam. It was her third attempt. So every time she gave exam, she had this question coming over and over again. Sometimes you're very lucky or unlucky, you can say. It's a luck thing that they bring you same question over again. Those who are repeating the exam. So be just mindful of that. Um, she discussed about this case in detail and she was struggling to find out the stem. So I searched for her and I remember this case very well. And every time they come, the case is coming. So snoring, mouth breathing. Okay, mother brought the child. So why the child will be snoring and mouth breathing? What is happening? When the child snore, which means obstructive sleep apnea, when can happen? Differentials. Stress. right? Adenoid. Yes. Tonsillitis, good. Adenoids. Adenoids. Okay. Foreign body, yes. Most common thing, adenoids is a common thing. Okay, start with the common thing. I'm saying obstructive sleep apnea. So, deities of obstructive sleep apnea. Laryngomalacia. 3 years old would not be thinking of laryngomalacia. Maximum is the age of 18 months. Diabetes the septum can be other cause of obstructive sleep apnea. Augustine, I don't know why English is not talking. Nose block. Okay. What else? Alicia, what else? Obesity, thank you. Child can be obese as well. I was looking for that. I was like, oh my god, at least one person should give me obesity. Okay, very common, very common indeed is obesity, and less common is actually adenoid. Yes, you have this history. Augustine, I get it. Um, you would be getting obesity is the more common one. Okay, how do you know that his neck is thick or his BMI is high? So you need to be addressing that. Okay. So yeah, adenoid, obesity, tonsillitis, nasal obstruction, trauma, allergy, rhinitis, foreign body. And can you see in this picture? What do you see here? What do you see in the for those? What do you see here? What's going on? I got this picture because people can't appreciate it. If you won't get a picture, you may get a picture in the exam. Tonsillitis they got. So what do you see in this in his throat? You don't see anything. Yeah, but there is also adenoid as well in the back of the floor. Okay. Yes, yeah, that is adenoid hypertrophy. You really find adenoid that being enlarged that come backward to the pharyngeal wall. Yes, tonsils are enlarged as well as the adenoid. Look at the carefully. I gave you that you can or you cannot see the adenoids. Okay, usually don't see it. You need to do laryngoscopy or something, and then we put the indirectly the mirror sort of a thing to check inside the throat. In ENT we do that. We put the laryngoscope, put the mirror to check on the behind the pituitary pharynx. In lateral X-ray we do it not in clinically as well. ENT we do that. We have like a small mirror which we put that in and to see the back floor of. So that's adenoid, but this is being very enlarged. Now the concern would be if anyone having tonsils, adenoid, they would be having difficulty swallowing, so they might have a dehydration. You need to assess the child for vitals from the examiner, and then you go from here. You need to ask about since when it has been happening. So yeah, it's your if someone says that in the question it's your regular patient, you need to see that person as a regular. You need to say that, oh, I good to see you again. I called you again. Hi, how are you? You can start with there. Don't get it surprised. Hi, my name is Rachna and blah blah blah. No, not it, because you're not doing first time introduction. Yeah, good to see you again. I called you because I want to ask you a few questions because child is having some snoring difficulties. So could you tell me when the snoring start? Yeah, always watch the stems what they're saying. If they're saying that your regular patient is coming, act like them as a okay, they are a regular patient. Is he being stopped breathing during the night? Is he actually having a lethargy daytime? Which means actually during daytime he's sleepy, which will be very common. Does he go to school? Is he playful? Is he tired all the time? Usually adenoid is enlarged, so they have a mouth breathing. Provided they have adenoid kind of faces, which means nasal dilation, and the discharges will be there. They get a recurrent ear infection, and they get recurrent throat infection and anorexia. That's a classical sign of the adenoids. Okay, so you do need to ask that. You do need to ask that if they having any headache because upper respiratory tract infection, which happens in sweating. Otitis media was already there and it's not getting better. Again, it's a sign of that. Ear pain and ear discharge. Ear discharge means any perforation would be suggesting, ear pain would be suggesting acute ASM, both sides. So you need to always assess that. And again,